The next category of antibiotic is a category called the macrolides. These are discussed in the text on page 74, and then they are the second antibiotic listed on table 5.2 on page 75. Macrolide antibiotics are bactericidal or static depending on which organism it's being used on and the dosage. They also weaken the bacteria by limiting their ability to use protein. So it takes a little bit longer in many cases to interfere with their protein synthesis, and it weakens and keeps the bacteria from multiplying. Our prototype drug is a drug called erythromycin, very common. Everybody's heard of it, I think. It is often used as an alternative for penicillin. If you've got a patient who's penicillin allergic and needs an antibiotic that will work for it, this is a very effective one. And there are certain organisms that it's more effective against than others. The main adverse reaction with erythromycin is GI upset. And when I'm talking GI upset, I'm talking you have to stop and grab your stomach because you're cramping so bad. Very, very unpleasant. I had to take it one time. All of the nurses in labor and delivery had to take it because we had an outbreak of pertussis in our nursery. And oh my goodness, that was a painful antibiotic. But that's very common. You can take it with food, and I advise you to, and you should drink extra fluids. In severe cases, these drugs can cause cardiac dysrhythmias, but that's very unusual. The main thing you're going to see is stomach cramping, possibly some diarrhea, and some nausea. You want to check the nursing text for drug interactions because there are a number of them on page 74. They increase the action of anticoagulants. Most of your antibiotics are going to increase the actions of anticoagulants. So people on Coumadin, for instance, who are taking antibiotics, they can end up with longer bleeding times. They can end up with brain bleeds, can be very dangerous. Also interacts badly with digoxin. You want to advise your patient to take with food and drink plenty of extra fluids because of the fact that it can make you feel so miserable. And of course, depending on the product, we have different strengths. But once again, like every antibiotic, rule number 2, take all medications until they are gone. The next category is a category called the Amino Glycosides. And these are listed on the table right below the macrolides, and the text covers it on page 76. Amino glycosides tend to be very strong broad spectrum antibiotics. When you use them, you know that over a period of time they can be damaging to nerves. Our prototype drugs are gentamicin and a drug called amikacin. They also limit the bacteria's protein production, but they tend to pretty much just kill the bacteria. They're used for very serious aerobic, that means they need to use oxygen, gram-negative infections. Now, these aminoglycosides can be very damaging to nerves, especially in the kidneys and the inner ear, so they can cause deafness, tinnitus, vertigo, and someone using them quite often can see blood in the urine and kidney damage. These drugs have traditionally required peaks and troughs to be drawn. A trough will show the lowest level of antibiotic in the blood, and the peak shows the highest level of antibiotic in the blood. Our textbook discusses peaks and troughs a little bit on page 76, and it's covered very well in our ATI book on page 330. The requirements for peaks and troughs may vary according to the facility. Sometimes facilities have stopped drawing peaks, seeing the highest level in the blood, and they just want to use troughs, which you draw right before you administer the next dose, and that tells if they need to adjust the level or not. And many of the antibiotics have their dosage adjusted by the pharmacist based on what the trough is. So make sure you read that page in your ATI book, page 330. So patient teachings, mostly what you want to do is tell the patient to watch for toxicities. Ringing in the ears, hearing loss, and any kind of indications of kidney damage are things that our patients want to watch out for because these drugs are very potent. The next category of drug, and they didn't really put them in order of when they were discovered. If they had, then sulfonamides would be the first ones listed because for a long time they were the only antibiotics available. Sulfonamides are discussed in the text on page 76. And if you go back to, let me see. Let me look really quickly. Do they have a section? Anyway, they are discussed on page 76, and I'm not seeing, okay, there we go. They have a table 5.3 on page 78. So your common sulfa drugs. Remember, sulfa drugs also have a tendency to give allergic reactions. Sulfonamides were first discovered in 1932 in Germany. They also were accidentally discovered because of a fungus that accidentally was exposed to pathogens and was shown to kill them. So when soldiers in World War II first started going off to war, they would take these kit bags with them that had all their supplies and equipment, and they would take big bottles of sulfa powder, and that way if they were injured, the first thing somebody could do was pour sulfa powder into this wound, and there was a possibility of stopping bacterial growth. Sulfonamides are bacteriostatic for both gram-positive and gram-negative organisms. They work on the ability of the cell to use folic acid, and if a cell does not have folic acid, it can't grow and function properly. Our prototype for sulfa is sulfamethoxazole trimethoprim, combination of two substances, and together, depending on what company makes them, their trade name is either Bactrim or Septra. Very commonly used. Now there are two main adverse reactions that you need to know about sulfonamides, and those are photosensitivity and crystals in the urine. Photosensitivity, once again, is extra sensitivity to sunburn. Now, we all have our point at which we start to burn if we are exposed to the AV rays in the sun, and it varies from person to person. If your skin is darker, it can take longer to do damage to the skin. If your skin is very pale, you can start burning in minutes. Redheads with very light skin can spend very little time in the sun before they start stinging. Well, if an antibiotic causes photosensitivity, what it does is about cuts the time in half that you are able to stay out in the sun without burning. And so it's very important to tell any patients on a sulfa drug that they need to use sunscreen, they need to wear sleeves, they need to wear a hat, they need to protect themselves from the sun's rays. Another problem is crystals in the urine that can eventually lead to kidney stones. So they need to be taken with a full glass of water, and lots of fluids need to be consumed with the sulfonamides the whole time they're taking it. It's a common allergen, so you can be allergic to other sulfonamides and to drugs that are chemically related to the sulfonamides. And you remember in chapter 8, we talked about thiazide diuretics. In chapter 17, we talked about the sulfonylureas for type 2 diabetes. So somebody sensitive to one type of sulfonamide can react and be allergic to others. Drug interactions, they tend to make oral anticoagulants work more powerfully, make bleeding times longer. They can butt heads with sulfonylureas and thiazide sulfonamide diuretics, and they can make each other work in a greater amount and give you greater reactions. They can decrease effectiveness of penicillins, and they can affect your lab tests to where they are not coming out accurately. On page 77, we see nursing implications and patient teaching for these sulfonamides. And the main thing is cover up in the sun and drink lots and lots of fluids. It's the best thing we can teach our patients taking these drugs.